Hi, let's talk about the nasal and the oral cavities. So the nasal cavity is supported externally by the nose, and it is an exclusive route for respiration. I'm not saying that food and drink can't leave via the nose, but let's just say that it's not meant to. The external structure of the nose is very simple. There is a bridge of the nose, and the bridge of the nose is continuous inferiorly down to the lip via the nasal columella. Then there are the ala of the nose. Ala is wing. And these ala surround the nares, or the nostrils. This is a sagittal section of a cadaveric specimen. We can see there is the nares, or the nostril there. The nasal vestibule would be the portion of the nose outside of the nasal cavity, and the nasal cavity then runs from the vestibule back to the choana, which is the internal nares. The nasal cavity is divided into right and left nasal cavities via the nasal septum, and that nasal septum is tripartite. We have the perpendicular plate of the ethmoid bone, the vomer, and some septal cartilage anteriorly. If we look at the lateral wall of the nasal cavity, we'll see three ridges. These ridges are called conchae, or turbinates. There's an inferior concha, a middle concha, and a superior concha. And what these conchae do is, as air is brought into the nasal cavity, it encounters this, and the turbulence brings as much of that air into contact with the nasal epithelium as possible. This warms the air, it moistens the air, it brings odorants to the olfactory nerves, and it traps any impurities in the nasal mucus secreted by the mucosa so that it may be eliminated from the respiratory tract. Now, between and among these nasal conchae are various recesses. So, for instance, superior to the superior nasal concha is the spheno-ethmoidal recess, which is between the superior concha and the sphenoid bone. Then there's the superior nasal meatus. The superior nasal meatus is between the superior and middle nasal conchae. The middle nasal meatus between the middle and the inferior concha. And then the inferior meatus, that's the inferior nasal concha. With respect to the spheno-ethmoidal recess, there's a very important communication between that area and the sphenoidal sinus. We can see that the opening here is traversed by this red wire. And what happens is materials can move between that spheno-ethmoidal recess of the nasal cavity and the sphenoidal sinus there in this recess. In the superior nasal meatus, we have openings for the posterior ethmoidal cells. As you may recall from osteology, the ethmoid bone contains a number of air cells. These air cells in total form the ethmoidal sinus. The posterior ethmoidal cells communicate with the nasal cavity via the superior nasal meatus. The middle nasal meatus has very many communications with different parts of the skull. If we look at the middle nasal meatus, we'll see that there is a semilunar hiatus, or there is this moon-shaped opening. And along that semilunar hiatus are openings and entrances to a few different structures. So represented by the blue wire here, we can see the opening between the frontal sinus and the nasal cavity. So this is the frontonasal duct that drains into the ethmoidal infundibulum, which is the funnel-shaped aspect of the anterior portion of the semilunar hiatus right there. We also have the anterior ethmoidal cells draining into the semilunar hiatus, and we have the maxillary sinus opening into the semilunar hiatus as well. So we have quite a few things here within this semilunar hiatus. The frontal sinus, the maxillary sinus, and those anterior ethmoidal cells are all communicating via this hiatus into the nasal cavity. The inferior nasal meatus is a little more simple. That includes the opening for the nasolacrimal duct. The nasolacrimal duct is a tube that connects the medial aspect of the eye with the inferior nasal meatus, and it's a pathway by which tears can move from the surface of the eye to the inside of the nose to help keep the nasal mucosa moistened. When an individual cries, more tears traverse this nasolacrimal duct, mixing with the nasal mucosa, and the duct can be overwhelmed and those tears may spill down an individual's face. The mouth and the oral cavity is a space by which both the respiratory and digestive systems share in common, and thus it's the proximal part of what people refer to as the aerodigestive pathway. The oral cavity begins at the mouth, so there's an oral fissure between the superior and inferior lips. And then the oral cavity may be divided into the oral vestibule, which would be the space between the lips and the teeth, and the oral cavity proper. The oral cavity proper would be everything beyond the occlusal surface of the teeth. And that oral cavity proper is going to contain the tongue and be continuous with the pharynx, in particular the nasopharynx. So we've discussed the pathways by which air may enter and leave the respiratory system, both the nose and nasal cavity and the mouth and oral cavity. Thank you.